Thank you. I just want to first say thank you to the organizers of this conference. It's truly an honor and a privilege to be with such a great group of people. The basic underlying theme that I hear from pretty much everybody is, well, how can we use what we know from our personal experience and from what the science and from the health, how do we incorporate this into the larger context of our healthcare and our healthcare system? And that's been the challenge and the opportunity that we've been faced with. That's what's in front of us right now. So I want to spend this next 30 minutes with you talking about how we can do that. I'll tell you a little bit first about myself. I am a type 2 diabetic in remission, coming up on my 3rd anniversary of having had a heart attack in March 2014. And Marty Kendall, the great Marty Kendall from Australia, who has the Optimizing Nutrition blog, did a story on what happened and how I use a ketogenic diet and intermittent fasting to basically today I'm off all medications. I still have to take a baby aspirin because I have a stent, but I'm off all my medications and I have normal blood sugars, normal A1Cs, a normal lipid profile. Last set of labs I did, my triglyceride to HDL ratio was 2. So that's pretty good for someone who had a really bad set of numbers when I had my event. And I was under the belief, like most people, that we were doing the right thing, taking the medication and following the diet that we were told, but really is very bad. And within my beginning this diet in the summer of 2014, by the end of September, I had my first time I had a normal A1C in more than 12 years. And then I told my doctor, Doc, you guys, I said, there's something really off here. If this can be done with the diet, why aren't you promoting it? Why aren't you teaching it? And why aren't we using this as the first method of choice? But you see, the overriding thing that you have to keep in mind is what we're dealing with is both economics and also human nature. This is going to be a big task because it's going to require, at least for a large segment of the population, the authorities were wrong. And in human nature, we don't like to admit error because then we have to be accountable. And that's part of the challenge. And then the economics, what economic interest is driving anything to change? It serves certain forces, players in industries to have things just the way they are. And if we were to upset that, well, what's going to happen? And another thing, part of human nature, is we don't like uncertainty, but we're always faced with that. I come from a career in public policy and the law. When I was 16 years old, I had the distinction to serve the late Senator Jacob Javits from the state of New York in the US Senate as his page, one of his final Senate pages. And that's how I learned how Congress works and Washington operates, because that job gives you really lets you be an eyewitness to the legislative process and the political process. And I became a lawyer. I come from a family of lawyers, and I liken my work as being a negotiator, conflict resolution, government relations, international relations. I've been doing this work for the last 26 years. I've helped get major legislation passed, the Dietary Supplement Health and Education Act and the FDA Modernization Act. I was personally involved in those efforts. And I also helped a healthcare company go from one state to go national, 50 states. And out of that, I had the opportunity to travel and visit 45 of the 50 states. I was teasing Jimmy Moore that I haven't been to Alaska, so maybe that's one of the 5 I haven't gone to, and to 26 countries. I'm presently a principal and manage the health policy practice of Gotham Government Relations, which has offices in New York and Washington, D.C., and we work on the area of healthcare policy, health insurance, food and drug development, regulation, and compliance. So for the doctors here, how do we integrate LCHF into your practice? Well, use the laboratory tests, values, the lab values, and the diagnosis to support your patient care and therapy. So if you're ordering cholesterol, if you're going to do a cholesterol panel on your patient, are you doing the NMR so that you can fraction the lipoprotein A and the lipoprotein B? And that's such a critically important diagnostic tool. Are you discussing and explaining how important the triglyceride to HDL ratio is for their risk factor of having a coronary event? And you've heard about the Kraft insulin assay, and put it into practice, because it's the superior lab measure, because it takes both the insulin and the glucose tolerance into account. And also, as we heard from other lectures here, that it is a very good predictor of that individual's likelihood of developing type 2 diabetes at some point along. And then that early information, you have an opportunity to intervene and interrupt and guide them off the diabetes expressway. So the other thing I want to talk about here is always come back to the foundation of the clinical justification to use LCHF, which is the metabolic syndrome and hyperinsulinemia. Make sure you're coding all your, all applicable diagnoses, and just here the hyperinsulinemia coding for the ICD-10 and the ICD-9. The codes are right there, and prediabetes. Use that, because that will lay the groundwork for you to justify and explain why you are using this therapeutic approach. Because then you get to have the conversation with the patient, which is what I call the good news, bad news. You tell, well, the bad news, you have these markers that indicate that you're going to develop type 2 diabetes, or you're a really strong candidate for having a coronary event. But we can do something about that. But here's the bad news. I can't really prescribe a drug. There aren't drug equivalents to correct all of these bad markers. There's no drug that I can give you to get your HDL up. If you have a bad trig to HDL ratio, you can say to the patient, hey, look, I can't give you a drug that's going to raise that HDL. Pharma has tried it several times. And has failed in the trials. They've not brought a drug to market to raise HDL cholesterol. And there is no drug to alter the lipoprotein AB profile. We have the cholesterol that lower them, but it doesn't necessarily, those drugs, alter the profile. And there are drugs to lower triglycerides, like, for example, Lovaza and Lopid. But the patient may or may not have the numbers indicated. For example, Lovaza is only indicated when you have a triglycerides of greater than 500. Anything over 100, we know, is bad. They've justified it to say, oh, if you have it at 150, but we know the lower the triglycerides, the better. And we can achieve that. Basically, Lovaza is highly purified pharmaceutical grade fish oil. There are ways by people eating in their diet, increasing the amount of omega-3s and using high quality fish oil supplements, that they can help bring their triglycerides down, as well as eliminating the carbohydrates and alcohol if that's a problem. And then you tell them, here, the good news is I do have a way, I do have a therapy I can offer you that will change all of this, and can do it if you follow what I tell you as a practitioner in a relatively quick amount of time. I was amazed, for example, when I started in the summer of 2014, and I had not had a normal A1C for 12 years, that in a matter of less than 3 months, I'd had a normal A1C, and my doctor was able to take me off Janamet at that time. So you can tell them, you can explain to them that using the LCHF diet and intermittent fasting, as we heard from Dr. Fung, how that is probably one of the most powerful ways to sensitize a person to their own insulin and bring down the hyperinsulinemia and the resulting insulin resistance that comes from that. So now we are in a new presidential administration. And everyone's trying to figure that out. The new HHA Secretary, Tom Price, was just recently confirmed by the Senate. But there are some things that we can at least think about how you are going to apply your practice and to speak from these points, because Secretary Price's healthcare approach is what we call patient-centered care. And that looks at these factors: affordability. Clearly, the LCHF diet is an affordable way of healthcare. Accessible, absolutely. It's accessible everywhere. And as, for example, even in areas which most of us wouldn't go to in certain, like, for example, fast food restaurants, there is even a way, as Dr. Westman explained, for some of his patients that they can use the food choices that are available out there to use the program. Quality, obviously, for example, when you do this approach, and like in my personal case, I did intermittent fasting all of 2016, every Monday going into Tuesday. I estimated I probably fasted 90 days out of, 3 months out of 2016, where the only thing I did was drink coffee, tea, or homemade bone broth. And so what I do with the savings, that's money I didn't spend at the grocery store. Well, I would use that money to buy higher quality meats, a higher quality seafood, organic vegetables, and better quality food. So it's possible. Innovation. Well, clearly LCHF has been around, but I would argue that it's new because it actually works and is a compelling alternative to deal with these healthcare issues. And responsiveness, clearly, this approach, when you follow it, works for a great number of patients. We know Dr. Feynman had published his studies that showed that this approach will definitely bring type 2 diabetes into reverse and into a remission state. So the question to be asking, and you should be thinking about when you hear about the healthcare debate, well, how does this approach fit into these set of principles? We'll see what's going to happen when the administration offers its replacement for the Affordable Care Act. The other thing to think about is a two-pronged approach for LCHF at the state level and the federal level. At the state level, we look at licensure and continuing medical education. That's where that's one area that has to be looked at because most doctors aren't aware of this approach. They're not taught enough of this at medical school. Most of you, the professionals here, took it on their own initiative to learn and become, experts in their area learning about this. But just try to imagine if all doctors were to get some CME on how to put type 2 diabetes in remission using diet. We would transform states that have been plagued with costs. For example, my home state of New York, the Medicaid bill for type 2 diabetes in the year 2015 was over $1.3 billion. And it's an unsustainable number. And all those dollars that are there have to go to are being used to treat those patients. When if we could probably cut that cost in half, and that would free up that money to go to other important, vital public necessities. So that, as you think about it at the state level, it's about working through the licensure, the medical doctor, and the healthcare practitioners. And the federal level, there are two important things. We heard a little bit about that from Nina Teichholz and the Nutrition Coalition. We need to change the nutritional guidelines. And that's a critical thing that has to happen. And the debate is really going to be over is, I don't want to say that the whole world has to be, go low carb, high fat, but clearly there is a measurable, defined population of people who absolutely need and should be following this type of approach so that they don't become obese, sick, diabetic, or heart attack victims. And the other problem on the economic side of this is because there aren't drugs to do this, because there isn't enough economic incentive to do this, we have to use our public research monies to actually do some of this research to really hone down the information. And that's why we have the National Institutes of Health. Obviously, there are the legal parameters that practitioners work in are the standard of care, and there is no medical definition for it, although the term is firmly established in the law and is defined as the caution that a reasonable person in similar circumstances would exercise in providing care to a patient. And the beauty of the low-carb, high-fat diet is because it does deliver the results very quickly. It makes a compelling logical and rational argument, regardless of what someone will say to you who's trying to defend orthodoxy, even if it's flawed. Logic and reason, you must always argue to that. If someone were to criticize you, to say, excuse me, my patient, he has gotten well, she has gotten well, her markers are all improved. I respectfully submit, maybe what we were taught to believe or we thought was correct is not correct. So it's really about establishing a dialogue. Applying the low-carb lifestyle and therapy, arguably the LCHF meets the standard of care for a number of health conditions, including type 2 diabetes and weight loss. So there you go. You have two of the highest cost conditions that affect us as a country on the planet, obesity and type 2 diabetes. So practitioners like you who are informed and knowledgeable should be developing, expanding, educating your colleagues on clinical practice guidelines for LCHF. And it was discussed here yesterday that, how do you take this into setting clearly setting standards? Well, you do that by coming together as an organization of professionals, and you submit them, and you have the government verify them and accept them, both from a standpoint of labeling and marketing and from advertising. And patients have a right to be informed and a right to choose their healthcare options. I know people that I have spoken with who, when they understand that this becomes possible for them, they say, I'd rather do the diet than take pills that I know that that haven't been working, or they don't notice the improvements. So empower your patients. You are their partners and stewards for good health. So the underlying problem that we're dealing with and the politics and the public policy of this is human nature. No one likes to be wrong. And who's going to be held accountable? And how will that accountability occur? The status quo is a vested interest. And when you have that, you have hubris and arrogance. That's why you see some of the pushback you've seen from certain academics and people who've staked their careers on the orthodoxy that they've now that we are dealing with. And an incredible investment was made on the low-fat, high-carb diet and saturated fat heart disease hypothesis theory, even though we know and believe that it precipitated and has facilitated the diabetes and obesity crisis. They applied a one-diet-fits-all approach, and we all know human beings are diverse, and we live and see the consequences of that bad information that we were given. There are nonprofit public interest health organizations that stake their reputation on maintaining this. Agribusiness, the grain, sugar, and processed food industries, they're going to push back on this. They're going to try to create as much doubt as they can. Even if they know that we are right, they will try to delay the process as much as possible because it impacts the bottom line. And again, people do not like uncertainty, particularly Wall Street investors. And we have now a pharmaceutical industry that has really created a Baskin-Robbins approach to diabetes. Every few months, a new diabetes drug is coming out, and you're like amazed. And there's no, only thing that we can do in pharma is manipulate the glucose, but what we've learned out of that important study, was the Accord study, that even though they were able to lower blood sugar, mortality did not decrease because insulin was high. That was what was not borne out of that study or reported or discussed. And that's the point where we have to go, excuse me, insulin is the issue here. And something that I tell people that I learned, I don't know who exactly to attribute this to, but I appreciate it. It's just respect your insulin. Because if you do not respect insulin, insulin will command it from you, or it will make you sick and kill you. So you must understand how that hormone works and respect it, because it's there, it's evolutionary, and it's actually there to give you good health. But we've misused its role through our bad diet. So caveats to take are avoid the one diet fits all paradigm approach. Low fat, high carb, vegan, vegetarian, superiority diets. Diet is not religion. And when people equate it to a religion, they're really now going to an extreme. And diet should be about, what do I eat that keeps me healthy, that keeps me from becoming sick, what gives me a normal weight? That is what your diet should be. Follow the science always and the evidence. And a compelling economic argument must be made beyond cost reduction. It comes down to how and who can and will profit from LCHF utilization and application. And you must always start from a local approach. The late Speaker of the House of Representatives, Tip O'Neill, would say, he was the one who coined the term, all politics is local. How many of you are talking to your local officials about what's going on in your practice, about the progress and some of the great cases that you've had? They need to hear about this. In fact, some of them, there are a lot of type 2 diabetics in the Congress and elected officials. I talk to some of them in the state of New York, and I tell them my story, and they're like, wow, what do I have to do? And it's very interesting. We're working, you should take it upon yourselves to get together, organize, and at a local level start talking about what this is doing to help people. So it requires organization, grassroots, participation at the local, state, and federal levels. Are you going to get involved? I also want to get this information translated into Spanish because this affects the Hispanic community disproportionately and people of color. Talk about human beings that were eating outside of what their evolution or what their genes, hunter-gatherers. It's really astounding. And we need to do that. And I set up a Facebook page called Centro Cetogénico on Facebook. And to anybody watching or listening, I'll say this in Spanish, that we look forward to having a conference like this in Spanish for Spanish-speaking communities here in the States and internationally. Esperamos dar esta misma información para la comunidad hispana, tanto en los Estados Unidos y por los países del mundo. The other thing is, get involved. The good news here is there is a grassroots organization already established. Nina Teicholz and her colleagues established the Nutrition Coalition, which is really about looking at nutrition from following the science and the evidence wherever it takes you, without the kind of orthodoxy that these other groups have tried to force upon the public. We have to complain and talk about the dietary guidelines because it's really a debacle. And engage LCHF's natural economic allies, which are the life and health insurance industries. And as we heard yesterday from Mr. Scooby's presentation, life insurance industry is really the foil to the pharmaceutical industry, because they have, it's in the life insurance industry's economic interest to have as many people insured at an affordable rate and living as long as possible. Whereas the pharmaceutical industry is interested in having people, they're obviously based on results. I don't see too many cures. They are interested in having people being on treatment for as long as possible. And people, when you're on treatment, it means you're sick. So it's a very interesting set of players, but I truly believe they're going to get engaged because it's a very powerful industry, the insurance industry. And then the health insurance industry will pick up on this. I was astounded at the cost of my coronary event back in 2014. Thank God I had the Affordable Care Act. I would have gone bankrupt if I did not have that health insurance. And I was an individual, didn't work for a large company or have a big health care plan, but thank God that the Affordable Care Act was there, and I had a very good plan, and I wasn't devastated economically from that incident. So the other industry to get involved with is the natural products industry. Because we talk about real food, we should be talking with and engaging the producers of food that are organic, high quality, minimally or unprocessed. We should be demanding the removal of added sugar from the food supply. For example, I couldn't believe this. I love mashed cauliflower. I like adding cheese and bacon to it even. And Green Giant, which I grew up as a kid, hey, ho, 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 Green Giant. They came out with a line of mashed cauliflower. They even came out with one, cheddar and bacon. So I look at the ingredient list, and doggone it, they put sugar in it. I called them up. They have a consumer. You should be looking at the labels of the foods that you buy that are not, that are processed or prepared. And if there's added sugar, you should call up the consumer hotline and say, why did you put sugar in here? Do you know now I can't buy it? Or do you understand that for people who are obese, who are diabetic, every carbohydrate gram matters? And we don't want, and the carbohydrates, the last ones that we want are coming from sugar. So I had a conversation, and I explained, but it just was so disappointing to see that. Why the hell did they put sugar in mashed cauliflower, as if it needs the stuff? So I'm like, I'll just bite the bullet and just make it myself like I do anyway. I thought out of convenience, but you have to read labels. It's very important. So these are your allies, your health professionals. These are the doctors who are practicing the keto LCHF, naturopathic doctors. And I truly believe government can and will be our ally, because when the government has to pay for all of this care and the taxpayer has to pay for it, if you're a legislator or you're an official and you have only a set amount of resources and you have all these priorities, but you have to address a large number, or a large part of your budget has to go to paying for all this stuff, and there's an alternative way that will eliminate or cut that cost in half, hey, government's going to say, I want to work with you. We need to do this because we don't have an unlimited amount of resources. The current costs of managing diabetes and obesity are unsustainable. So my thanks to Ivor Cummins, Jeff Gerber, Nina Teichholz, Eric Westman, Jimmy Moore, Artie Dykman, if you're watching or listening, and other people that I've had the honor to meet. Really, I'm so honored that Dr. Fetke and his wife are here, and other folks that may be watching or listening. Marty Kendall, who's from Australia, has a wonderful blog called Optimizing Nutrition. Jeff Sear, this is an amazing human being, a man who took a terrible situation, health situation, turned it all around, and it is a source of inspiration to thousands of people in social media. I've told him, and he writes so well, that he should be putting this all together and publishing a book, because he's able to hone all this scientific and technical information and put it in layman's term in a way that people understand it. And then I have to also give a shout out to Sandy Barr, who has the Reversing Diabetes group on Facebook. That was part of my journey to recovery and getting well. And there's another guy there, Bob Briggs, the butter makes your pants fall off. He has a YouTube channel and is another gifted person, a layman, who is able to take all this complicated information and translate it and communicate it that other regular people can understand it. And the late Dr. Robert Atkins, who I had the privilege to know and work with when we were working on the supplement legislation, and in his tragic death in April of 2003. We were going to, at that time, meet with, and he had met with then Health and Human Services Secretary Tommy Thompson, and they were going to talk about low carb, but he had this terrible accident, and that was the end, we know. But we know the other great doctors and scientists who carry on the work, and so I thank you. I look forward to working with you and bringing this message to the halls of government and to our elected officials. Thank you.